everyone, my name is Jordan Redmon and I am a pelvic floor physical therapist located at KORT Brannon Crossing. I treat females only, and then this is Tori. She is the clinic director at the Eagle Creek location, and she treats both men and women. Today, in honor of Mother's Day, we are going to talk about pregnancy, postpartum, and clogged milk ducts. If you guys have any questions, you can just comment in the box, and we will also put our emails there too. So if you don't feel comfortable, if you want to talk to one of us in private, just feel free to reach out to us. So today we have Miss Amy and Holly behind the camera, and they're going to be asking us questions. So I'm going to let Tori talk about pregnancy and postpartum, and then I will finish up about talking about clogged milk ducts and how to get scheduled. So take it away, Tori.
All right.
Perfect. So first question, just what is pelvic health dysfunction?
Sure. So the pelvic floor is a group of muscles at the base of your pelvis. Their main functions include bowel and bladder function as well as sexual function. And so pelvic floor dysfunction is mainly anything related to those functions, including incontinence, constipation, pain with sexual intercourse, and several other issues similar to those.
Yes, so can you talk about pelvic health therapy before and after pregnancy specifically?
Yes, absolutely. So before, during, and after pregnancy, pelvic floor can help with a variety of issues, including incontinence, abdominal separation, different things like that, and also can help you prepare for labor and delivery.
What are some symptoms mothers could have during pregnancy?
During pregnancy, it's very common to have some type of back pain related to the changes that your body is going through, accommodating baby. So that can include just back pain or pelvic pressure or pain. Sometimes incontinence can or leaking of urine can occur during pregnancy. And then also you might notice something a little less common, but that can happen, is carpal tunnel syndrome during pregnancy.
We can help with too.
Yes, we can definitely help with that.
So then what are symptoms after pregnancy that new moms might experience?
Absolutely. So a lot of times new moms will experience some incontinence or leaking of urine, some difficulty healing, or some scar tissue or pain involved from the act of labor and delivery. Can also have some separation of abdominals, or what we call diastasis recti, really all kinds of different things, but we help with all of it.
So is it normal to leak or lose urine when you're running or jumping or laughing?
Although it is very common, it is not normal, and it is absolutely something that a pelvic floor physical therapist can help you decrease the occurrence of.
So what could I expect on my first appointment?
Awesome question. So on your first visit, we will do a lot of education to help you understand what the pelvic floor and the core involve and why it might even be helpful to you. We'll do a general evaluation, which will highlight muscle strength, range of motion, and kind of focus in on what your symptoms are, and then we'll come up with a really good plan to get you back to what you want to do.
And then how many sessions does that typically take for pelvic health?
Sure. So everybody's a little bit different, but usually somewhere in the 6 to 8 week range, and number of appointments a week can be anywhere from 1 to 2 times a week often.
And then, so I guess moving to the clogged ducts. Jordan, can you tell us more about that program here at KORT?
Yeah, so I started the clogged duct program about a year ago after getting hooked up with a lactation consultant here in town. And we just realized just how important it was and underserved this population is. So a lot of times it's usually the first 12 weeks postpartum that women experience a clogged milk duct, but that's not always the case. Sometimes it's a lot longer. I've had patients who have been a year postpartum who are still nursing. But a clogged milk duct can range from either like a marble size or even golf ball size clog. You'll feel it, it'll feel tender, you'll feel it in the breast tissue. You'll have pain, decrease in supply, and it can be caused by so many different things. It can be caused by an oversupply in milk, the baby's latch isn't great, so you're having problems nursing, wearing tight fitting clothes. That is all stuff that we will go over on the first visit. So we'll give you lots of tips, or even like possibly refer you to a lactation consultant. Things like that.
Perfect. Then how many sessions does that usually take?
Yeah, so the clogged duct, that's a lot shorter than the pelvic PT. So that's like 2 to 3 consecutive days. So we'll either want to do like Monday, Tuesday, Wednesday, or Tuesday, Wednesday, Thursday, something like that. The longer you have the clog, the more visits it'll take. So that's more when it's like 3 visits. If you have just gotten it and you call that day, you will probably be fine just having 2 visits. And then research shows that it will likely go away within like 3 to 5 days following the last ultrasound.
Okay. How will I know if I have mastitis, and like what symptoms should a breastfeeding mother look for? Or be aware of?
Mastitis is not fun and it's very scary for new moms. That's more when the clog turns into an infection. So you're gonna see more like global body symptoms like fever, flu-like symptoms, cold. You just really feel miserable. That's why we want to treat clogged ducts so fast, and we recognize the importance of this program. If you have mastitis, you'll want to call your OBGYN or your primary care or your lactation consultant, because you might need antibiotics if they feel it's appropriate. We can still do the ultrasound, but we will also want you under care of a physician.
Definitely. So what can I expect on my first appointment for that and during therapy in the clinic?
Yeah, so the first appointment is a little bit longer. It's like 45 minutes to an hour. We'll do a general musculoskeletal exam, a lot of education, kind of talking to you about just like the baby's latch, posture during breastfeeding or pumping, anything like that. We'll do a musculoskeletal exam, look at shoulder range of motion, your spine. Then we'll jump right into manual therapy. So we'll work on you to facilitate drainage, followed by ultrasound and heat. You are more than welcome to bring your baby. If you can't find childcare, because I know it's hard, feel free to bring them. Sessions after that first one are a little bit shorter. Those are quick, like 30 minutes. You'll come in, it'll skip right to the manual therapy, ultrasound, and then heat.
Okay, and you mentioned bring the baby. So do you recommend to continue breastfeeding while you're having this treatment, or if you think you have a clogged duct?
I say do whatever is your normal schedule. So if you're worried about like pumping, or I've had patients call and they're like, should I pump right before, or should I nurse right before or after? Don't change up your schedule. We'll work into whatever time of day is fine for you. You can continue nursing as often as your baby needs during this.
Awesome. So how quickly can I get scheduled for the pelvic health appointment? I know that can take a long time.
Yeah, we pride ourselves at KORT just getting patients in because we recognize how important this is. I know many clinics, they have like a wait list of a couple months, and we get our patients in within the week. Now, in terms of clogged milk ducts, we get those patients in within 24 hours because we don't want it to turn into mastitis. So if you call in the morning, we will get you in that day. It might not be at the exact clinic that you want, but we'll work around like other clinics and get you into a clinic near you.
And then is pelvic health covered by insurance?
Yeah, we accept all major insurances, and if we don't accept your insurance, we offer a self-pay option.
Great. And then how can I make an appointment for pelvic health at KORT?
The best way to reach us is to call 1-800-645-KORT.com or 645-KORT, or you can go to KORT.com.
Thank you, guys.